on the 0 Hour. This is your host, Richard RJ Eskow. We've been talking a lot on this program about the nursing home crisis, and it turns out that when private equity and nursing homes get together, it's not a good thing. But you might assume that, but our next guest and his colleagues have researched that very carefully and documented it. So without any further ado, let me introduce Patrick Woodall. Patrick is a senior researcher and writer at Americans for Financial Reform and the Americans for Financial Reform Education Fund. It's a great organization. You should check it out. Without any further ado, Patrick Woodall, thanks for coming on the program.
Thank you so much, Richard. It's great to be here.
It's great to have you, and thank you for doing this important report. So rather than me trying to summarize your findings, why don't you tell us what you found?
Sure. I think, private equity is an industry that takes huge amounts of capital and invests and takes over companies. There are lots of noted examples like the destruction of Toys R Us in the retail sector and other places. In healthcare, they've been extraordinarily active. Over the last 20 years, they've bought up hundreds of nursing home chains. Now, nursing homes are generally invisible to the public, but today, during the pandemic, it's super obvious how important quality care at these facilities is. And private equity historically has had worse quality ratings from the Medicare rating system. They have had lower staffing ratios. They have higher levels of violations of federal standards. And that's what the academic literature said. So we wanted to look and see what happened, knowing that generally private equity-backed nursing homes have much more problematic history. What would happen during a pandemic? And we looked in New Jersey, and where there was a very early outbreak that had a really devastating effect on nursing homes in the state. And what we found was that private equity nursing homes had higher infection rates than all other kinds of nursing homes, even more than other for-profit companies, that the fatality rate of residents was much higher, that there was a disproportionate caseload and fatality rate relative to their share of the number of residents. So all of this suggests that the private equity nursing homes are doing worse. And it's not surprising. These are companies that reduce staffing, that cut corners, that have imposed great financial burdens on the nursing home chains they took over. And now, ordinarily, this is terrible and bad for quality and bad for workers and bad for the residents that live there. Now it is actually calamitous and fatal. So it's a really brings into sharp focus the kind of negative impact that private equity can have on healthcare.
Now, many years ago, Patrick, I wrote a piece about pharmacy chains of private equity, and I didn't do the level of research you guys did, but I tracked down multiple cases of pharmacy chains. Duane Reade was one of them, where rule breaking, law breaking, various scandals seem to occur more readily. And I looked into some of the reasons for that, but I've not looked into the history of the nursing home problem, even pre-COVID. So I guess my question would be, and I'm not sure this came out in your research, but do you have any sense of why the outcomes, the measurements were worse either pre-COVID or during COVID? Is it because they were understaffed? Is it because they were cutting corners in general? Is it because they didn't provide adequate medical care? Do you have any sense of, although I know that's paid for separately, but do you have any sense of what some of the factors might have been behind this?
So the private equity business model relies on a bunch of financial engineering techniques that impose great financial burdens on the companies. So generally they use leverage buyouts, which means they buy a nursing home, but they force the nursing home to borrow money to pay for the takeover. Right. The nursing home is responsible for repaying that, but not the private equity firm. Oftentimes they siphon away the real estate. So they will take a nursing home chain, and all the land under the nursing homes will go into a separate shell company that is held by the private equity firm. So the nursing home goes from a world where they had no debt and they weren't paying rent to a world where they're paying rent and have to pay off a new debt load. So and they are under great pressure to generate profits and revenues and fees for the parent company private equity firm. All of this creates incentives to crimp on quality, to reduce staffing, to cut corners, and on a regular basis, on a pre-COVID world, the academic literature found that there were worse health outcomes, that there were lower staffing ratios, that there were more quality problems, there were more federal deficiencies. We found this in the Jersey nursing homes, that the private equity-backed nursing homes in New Jersey. And what this suggests is that even under an ordinary non-pandemic world, that these homes struggle to provide as much quality care as other even for-profit chains, right? Let alone not-for-profits or public facilities. In a pandemic world where these are such more financially vulnerable and brittle operations, they just don't have the wherewithal or the capacity, or maybe they don't have the incentive to actually deliver the kind of quality care that's needed to prevent a highly infectious disease in facilities that are overcrowded and with residents that are extremely susceptible to infection.
You said, and again, we're talking with Patrick Woodall of Americans for Financial Reform. You used an important word there, I think, Patrick. They're all important, but the one that I'm thinking of is incentive. You have executives at these nursing homes, managers and everyone in a position of authority, responsible to, accountable to a private equity firm. And I would venture to guess that their financial incentives are not based on how well the nursing home performs in a quality review or whether they meet federal guidelines or state guidelines, rather, et cetera, et cetera, et cetera. I would assume that, and I think I'm guessing I'm right, that their incentives have to do with profit margins and strictly financial measurements. By the way, it was exactly the same with the pharmacy chains, highly leveraged buyouts where they're deeply in debt. So they have to pay off their debt and make money. And I'm guessing that that's what their incentives are. But am I right about that?
I think the private equity business model relies on very perverse incentives, regulatory loopholes, and taking advantage of the tax law to really extract value out of the target firms. And so what that means is that for the target firms, they really can struggle under this situation where they have way more debt that they have to repay, and they have a demand to produce profits and revenues for the private equity owners. Oftentimes, the private equity also take out dividends that are payments that come out of the company and impose fees on the target company, management fees, right? So there's a huge amount of money that is being siphoned up to the private equity firm. In a healthcare situation, every dollar that is taken out of that nursing home that could have provided care to provide profit for the nursing home is really coming out of the residents and the workers. And obviously the most critical element of providing care in a skilled nursing facility is the amount of caregivers there are. And so having private equity firms provide lower levels of care, less staffing. We found that in New Jersey that the private equity nursing homes were providing about 3.6 hours of care per patient per day when adjusted for the medical need of the residents. And that's about an hour less a day than is provided by not-for-profit and public facilities. So that's a huge difference in terms of the quality of care provided to residents.
One of the things I was thinking when I read your report, Patrick Woodall, your Americans for Financial Reform report, was that roughly 65% of nursing home payments are typically made by Medicaid. Now, I don't know how that breaks out for these particular facilities, but to a certain extent, it struck me that there was a kind of wealth transfer going on from the public, from the working people of this country, to wealthy private equity investors, and at the expense of the people in these nursing homes. I don't know what you think about that thought, but it seems to me that's one of the dimensions of what's going on here.
It's all of these private equity business models are highly extractive. In a nursing home setting, it is extracted out of the care provided to patients. Much of this care is from public health programs. Medicaid and Medicare together make up the overwhelming majority of financing for nursing home care. The workers at these facilities are paid a pittance, often have little or no benefits, and those things add on to the kind of COVID risk that they're facing, right? Workers who are asked to come in when they're sick can actually spread the virus to the residents and to their colleagues. So all of this is really pulling out of from the most vulnerable people in the country, the residents of nursing homes and the low-paid workforce that are providing care for them. So, and it's going to the Wall Street fat cats. And so it is an incredible wealth transfer. Remember that the majority of people, these are most of the money is Medicaid, some of the money is Medicare. And so these are working class and lower income people with great medical need, and that is being siphoned away. The money that could have gone to provide that care is being siphoned away to line the pockets of private equity firms.
And now that the pandemic's here, it's literally killing people. So I can't overemphasize in my mind how important a story I think this is. I know you only studied the state of New Jersey, but were there particular private equity firms that you came across that were dominant players in this that maybe people should know about, know the name, and if nothing else, so that they can bear the moral stigma of what they're doing?
So at a decade ago, the big three of the biggest chains were all owned by private equity. So Manor Care was owned by private equity, Genesis and Beverly, which is now called Golden Living, were all owned by private equity. But subsequently, Manor Care has gone into bankruptcy. Golden Living came apart at the seams because of quality issues and a series of lawsuits by plaintiffs and the federal government. And Genesis went public again. So those are no longer private equity-backed firms, but the problems at Manor Care and Golden Living should be a sort of warning sign for others. Most of the private equity-backed nursing home chains now are smaller in scale. They are not hundreds and hundreds and hundreds of facilities like some of these bigger companies. They are dozens of facilities in a couple of states. There are some pretty well-known ones that are still private equity backed, like Consulate, but in general, they are smaller chains in a more narrow geographic footprint. The national chains are sort of either broken into pieces or no longer owned by private equity.
So where can people go to find your report? Because I think it's important that people be aware of this, and then hopefully we'll build momentum for a movement to make some changes. But where can people go to find your report, Patrick?
So the report is at our website, which is ourfinancialsecurity.org, ourfinancialsecurity.org. And it's right up there, as well as lots of material on the private equity industry generally, and its kind of attack on working people and pensions and everything else that is available too.
Well, you guys do great work, so I encourage people to go check this report out and the other work as well. So Patrick Woodall, let me see if I get this right from memory, writer and senior researcher, I believe it was, at Americans for Financial Reform and the Americans for Financial Reform Education Fund. Thanks for doing this great work, and thanks for coming on the program.
Thank you very much.
And we'll be right back after this. I am RJ Eskow, and this is the Zero Hour.